Let me start with something most practice owners already know. Managing chronic disease is rarely a clinical problem for mid-sized practices. The medical protocols are well established, the electronic health record systems are fully equipped to handle the documentation, and the reimbursement pathways are clearly defined through Medicare's Chronic Care Management Program. The actual point of failure is capacity. Practices face a relentless, grinding shortage of the administrative bandwidth needed to actually execute follow-up calls and log the required documentation. Data from the Centers for Disease Control and Prevention shows 6 in 10 American adults live with at least one chronic condition. This chart illustrates the sheer volume of preventable emergency room visits against total healthcare spending by chronic disease patients. Without consistent outreach, these patients contribute to 4.3 million avoidable ER trips every year. Failing to staff care coordination teams directly results in a degraded, reactive care pipeline, where interventions happen only after a patient's health has already deteriorated. The Medical Group Management Association reports a 40% annual turnover rate for front office support staff. Looking at this waterfall chart, you can clearly trace the compounding financial damage. Replacing a single medical assistant drains between $9,000 and $12,000 across recruitment, training hours, and lost productivity. That revolving door poses a severe operational risk. Disease management requires a highly specific intersection of clinical knowledge and strict administrative consistency. When dedicated administrative staff leave, their uncompleted tasks migrate upward, landing directly on the core clinical team. The American Medical Association has tracked the result. For every 8 hours of scheduled patient time, office-based physicians now spend more than 5 hours deep in the EHR completing documentation. This cycle of attrition actively burns out providers and drains practice capital. Practices are solving this capacity problem by deploying dedicated virtual medical assistants. These are distinct from generic call center agents. Every remote specialist completes 40 or more hours of practice-specific orientation, learning exact outreach protocols and escalation pathways. This network schematic maps how secure data flows directly from a remote node into central EHR hubs. The virtual team operates inside the exact platform the practice uses every day. Every documentation entry lands precisely where the clinical team expects. Embedding a dedicated remote team ensures that practice-specific institutional knowledge remains intact, even if a local staff member leaves. Direct EHR integration turns chronic care management into a permanent, reliable workflow. The Staffingly model pairs these trained human specialists with automated AI-assisted quality controls. Natural language processing tools extract key data from calls to pre-populate EHR fields, sharply reducing manual entry errors. Duplicate detection algorithms catch redundant entries before they trigger downstream billing discrepancies or compliance reporting errors. Predictive scheduling tools analyze the practice's workflow patterns to determine the optimal time to contact patients. These automated checks ensure preparatory work is complete before the end of the day, effectively ending the hours physicians spend doing documentation at home. Rigorous AI-backed oversight guarantees that clinical outreach is matched by perfectly compliant documentation before it ever reaches the doctor's desk. Structuring care coordination this way yields a 64% reduction in loaded labor costs. This side-by-side bar chart visualizes the contrast. Practices pay $21,600 annually for a dedicated remote worker, compared to over $60,000 for an in-house hire, saving roughly $39,000 per position. With reliable documentation finally in place, practices capture the roughly $40 per beneficiary per month available under Medicare CPT code 99490. Consistent billing of non-face-to-face coordination services generates annual revenue increases that frequently exceed $75,000. Staffingly currently manages these operations for over 800 healthcare providers, backed by full HIPAA and SOC 2 Type 2 certifications. The staffing pipeline cannot heal itself. Practices can deploy a fully integrated remote team in 48 to 72 hours with a 30-day free trial, permanently securing their patient care pipeline.